to Avisena channel. In today's episode, we will be talking to Dr. Ragu Ramasamy, our Consultant General and Colorectal Surgeon. We will be talking about colorectal cancer and what is it, in conjunction with Colorectal Cancer Awareness Month. Come, let's go see him now.
Okay, let me explain through the diagram that I have here. First, we look at anatomy of colon and rectum. Yeah, we have colon as the beginning, where the small bowels are joining at the colon, and then we have an ascending, transverse, descending, sigmoid, and rectum. So the rectum is the lowest part of the colon and rectum. That means just before the hole down here, this is 15 centimeter above that is called the rectum. So any cancers that's arising along this line is called as the colorectal cancer. If you look at the colorectal cancers, only 10% is genetic. 90% of colorectal cancers is sporadic. That means anybody can get it. The risk factor is also depending on whether you are obese patients, and then patients who are not taking enough fibers, patients who the diet does not contain vegetables, patients not eating fruits. All this does contribute to the patients having a higher risk than normal to develop colorectal cancers. Where we have non-invasive and invasive kind of testing, and most patients we would recommend, if you're more than 50 years old, you fall under the average risk categories and you should be screened. And we have fecal testing, which is called immunohistochemical fecal occult blood test, whereby you just have to give your stool, and this can be tested for blood. But when there is blood, then you have to go for colonoscopy. The difficulty about this is you have to be tested every year. And there's also colonoscopy, which is quite safe nowadays in a very experienced and trained hand. You can go for colonoscopy as a form of screening. When we're talking about colorectal cancer treatments, we divide it into colon cancer treatment and rectal cancer treatment. If you can remember, the rectum is 15 centimeter from the anal verge. That means the hole down here, and it's about 15 centimeter is called rectum. And this treatment differs from the colon treatment. The colonic treatment, when there is a cancer, is the mainstay of treatment is surgery. Surgery first, and then depending on the staging, that means we stage by CT scan. We also do the histopathological staining. That means the specimen that's been taken is sent to the histopathologist, and they also stage, because we look at nodal status and also whether it has gone through the wall of the colon. So when this staging has been completed, depending on whether we need to give this patient chemotherapy or not. There's no radiotherapy involved in colon cancer management.